Now, these are the MCQs of the cardiovascular pharmacology. We will discuss one by one with the different options and correct answer. The first question is, which of the following is the pharmacological action of digoxin on heart? And you will find in the different options there is a relationship between the heart rate and two parameters are discussed: heart rate and force of contraction. Now the digoxin is having, as you all know, that it is a cardiac glycoside. It is used for the treatment of congestive cardiac failure. So it increases the pumping function of the heart. So obviously it increases the force of the contraction, but it will not increase the heart rate, because you all know that we require that increased pumping of the heart, but at the same time it will not jeopardize the blood supply to the heart. And we all know that the blood supply to the heart is during the diastole. It means that when the heart rate is increases, the diastolic period is reduces, and that will not happen in case of the digitalis, because digitalis decreases the heart rate. So the blood flow to the heart will not jeopardize. So the correct answer is increased force of contraction and decrease in the heart rate. Okay, and you just remember three important points: digitalis increases force of contraction of heart, decreases heart rate, and decreases atrioventricular conduction also. Second is, which of the following agent is contraindicated in decompensated heart failure? Now, as the heart failure progresses, there is a time will come even when our body's compensatory mechanism it will not operate. So whatever the pumping action of the heart, it is due to the sympathetic activity. That's why the patient is surviving. Now, and if you block the beta blocker at this stage, then it could be fatal. So metoprolol, a beta cardioselective beta blocker, even though it is effective, it will prevent the disease progression, but in the early case, once the patient enters into the decompensated stage, then these beta blockers are contraindicated. So the correct answer is metoprolol. Symptomatic improvement as well as the disease progression preventing action is seen with, now you know that there are certain agents, the agents that reduces the preload, reduces the afterload, then increases the fluid loss, and the diuretics, all these are having a symptomatic improvement. And there are certain agents like AC inhibitors, cardioselective beta blockers, spironolactone, these all are having disease progression preventing action. But you know that enalapril, it is a AC inhibitor, it will also reduces the afterload and preload, so it is having dual action, and that's why they are indicated in each and every case of the congestive heart failure. So the correct answer is enalapril. Low molecular weight heparin. Yes, there are many advantages of the low molecular weight heparin. First and foremost is the better subcutaneous bioavailability, inter-individual variation is less, monitoring of the blood parameters is not required. Yes, even though the risk of the osteoporosis on the long-term use is also very less, and that's why for the maintenance therapy it has replaced the heparin altogether. But for the rapid onset, when you require an immediate action in the emergency condition, the unfractionated heparin is preferred. So the correct option is rapid onset and short duration of action. This is not the advantage of low molecular weight heparin. This is seen with the unfractionated heparin. Then broad spectrum antiarrhythmic, it means that it is having a different, it is having a class 1 action also, class 2 action also, class 3 action also. So the broad spectrum among all these is amiodarone. Yes, this is a very important question. Identify the correct statement. You all know that nitrate is the very important drug because it causes a selective coronary redistribution. Selective coronary redistribution means it will dilate the bigger and geographically visible epicardial coronary vessels. Okay, it is having a least effect on the intramural and intramyocardial and perforating branches. And you all know that ischemia is a potent vasodilator. So because of the dilatation of the bigger epicardial coronary vessels, the blood flow is selectively distributed. to the ischemic area. I will explain, this is a somewhat difficult, so I will explain through the figure in my next presentation this selective coronary redistribution. But the correct option is preferential dilatation of bigger epicardial coronary vessels with least effect on smaller intramyocardial vessels. And here a very important question, you have to identify the different conditions of the hypertension. Hypertension in the emergency, hypertension in the pregnancy, hypertension in diabetic patient, and hypertension with benign prostatic hypertrophy. Now in the emergency condition, obviously we require a very rapidly onset acting agent with the quick termination of action. So you can titrate the dose, and that is ultra short acting beta blocker, that is esmolol. In the pregnancy, the safer drug is alpha methyl dopa. Another option can be labetalol. Hypertension in the diabetic patient, you know that ACE inhibitors are having renoprotective action, so the ACE inhibitor enalapril. And hypertension with benign prostatic hypertrophy, alpha blockers, they are having additional action, relaxing the sphincter, and it improves the urinary outflow. That is the problem in the benign prostatic hypertrophy. So the preferred agent is selective alpha 1 blocker, that is prazosin. Which of the following anti-anginal agent is preferred in the stable but contraindicated in Prince metals angina? Now, we all know that in the Prince metal angina there is a problem with the coronary vasospasm, and we cannot give the agent which again aggravate this vasospasm, and the beta 2 receptors are present on the coronary vessels, and if you give the beta blocker, it will constrict the coronary vessels and it will aggravate. So the answer is the beta blocker, that is atenolol. Now the question arises in your mind that sir, atenolol is a cardioselective beta blocker, but selectivity is always relative, it is not absolute, and that's why even though the cardioselective beta blocker atenolol is very effective in stable angina, but it is contraindicated in Prince metals angina. Now there are certain differences between heparin and warfarin. Okay, and here we have to identify the correct statement. Okay, so we just omit the incorrect statement. Both heparin and warfarin are contraindicated in pregnancy. No, heparin is preferred, warfarin is contraindicated. Then heparin is preferred over warfarin for immediate. Yes, it is a correct answer. Chances of drug interactions are more with heparin. No, it is more with the warfarin. And variability is marked in case of both. No, it is also incorrect. So the correct option is heparin is preferred over warfarin for immediate anticoagulant action. So heparin is indicated for the initiation of the therapy, while the warfarin is indicated for the maintenance therapy. Now here we want the preferred hypolipidemic agent which effective in controlling the raised plasma triglyceride level only. The question is the only, and that's why the fibrates, when only the triglycerides are elevated, you don't require action on the LDL, then the fibrates are the drug of the choice, and the agents are fenofibrate, gemfibrozil. So the correct option is fenofibrate. Adverse effects of the nitrate not due to the vasodilatation. You all know that nitrates causing coronary vasodilatation as well as peripheral vasodilatation, and because of the vasodilatation there is a throbbing headache, there is a flushing. Because of the vasodilatation there is a reflex tachycardia, so palpitation is also there, but the tolerance, it is not due to the vasodilatation. So the correct option is tolerance. Yes, ascending order of efficacy of the diuretic agents. It means that the first the least effective, then somewhat more, then still more, then still more. Now here you have to think that which are the weaker efficacy of diuretics. These are the carbonic anhydrase inhibitor, potassium sparing diuretics, osmotic diuretics. So weakest is the amiloride, followed by the medium efficacy, that is hydrochlorothiazide. Now again in the thiazide group, metolazone is the agent which is the most effective. So then metolazone, and you all know that the high ceiling and highly efficacious diuretic is furosemide. So last one is the furosemide. So the correct option is amiloride followed by hydrochlorothiazide, still more metolazone and furosemide. It has been stated that many times the metolazone is equally efficacious to the furosemide also. Then select the correct statement regarding the verapamil and nifedipine. Both are calcium channel blockers, but they are having a different, diverse set of the pharmacological actions, different indications also. Nifedipine reduces the automaticity of the SA node equal to that of verapamil. Wrong. Both verapamil and nifedipine has a vascular smooth muscle relaxant action. Yes. then you can ask that, sir, if it is yes, then why both cannot be used as an antihypertensive? No, because the verapamil is predominantly having the effect on the conducting system of the heart. It is used as an antiarrhythmic agent. So the correct option is both verapamil and nifedipine as a vascular smooth muscle relaxant action. But again I am repeating, based on that we can't use both as an antihypertensive agent. Then match the following. Here the drugs are there and you have to select the adverse effects. Spironolactone, it is a potassium sparing diuretic and one of the characteristic adverse effect is gynecomastia. Ticlopidine, okay, you know that the ticlopidine, it is a very effective antiplatelet drug, but because of its effect on the this granulocytopenia, thrombocytopenia, and because of that it is outdated, and based on that the clopidogrel, it is used nowadays. So with the ticlopidine, pancytopenia. Atorvastatin, you know that the statins there usually lead to the muscle weakness, muscle pain, and sometimes it may lead to rhabdomyolysis. And hydrochlorothiazide is the thiazide group of the diuretic, and sometimes in high dose or long term use it may lead to hearing loss. Okay, so this type of the discussion of the questions, the in the MCQ test, not only the correct answer that is helpful, but how you derive the correct option, why the other options are not correct. It will help you to prepare the topic. And in the next video, in the next week, I'm giving commitment to you that I will explain you the selective coronary redistribution with the nitrate as well as the coronary still phenomena. Thank you.